Hey carnivores, welcome back to the channel. It's me, Bella the Steak and Butter Gal. I hope you all are having a Gouda meat-fueled day as usual. Drop a comment down below and update me on any progress that you've made so far since my last check-in video. And feel free to follow me on Instagram at Steak and Butter Gal for even more carnivore content, quick and easy tips and recipes. Today's video features the brilliant Dr. Rachel Brown. This is my first time inviting on a guest with an expert background in mental health and psychiatry. In today's conversation, Dr. Brown will be discussing exactly how food directly impacts our brain. Dr. Brown has dedicated her life to studying the relationship between lifestyle, diet, and mental health. And she will be sharing her advice on what to do with diet and nutrition, as well as lifestyle habits that we can start implementing now to support the most optimal mental health and mental function. Before I invite her on, I do want to also announce that Dr. Rachel Brown will be a guest speaker this month in the September 30-day Carnivore Challenge. I know for a fact that I will be inviting her on as a regular visiting guest speaker, but if you would like to attend her live Zoom Q&A, where you get to submit your personal questions to her and she will answer live on Zoom, please do sign up for the September Carnivore Challenge. The rest of the September guest speaker lineup is pretty amazing, and I'll just put it on the screen for you guys to take a look. We're going to be having Dr. Elizabeth Bright, Dr. Robert Kiltz, Dr. Rachel Brown, Professor Bart Kay, and Coach Cherish Thompson. You can always go to sbgmeetup.com or click the link down below to see the upcoming guest speaker lineup. So without further ado, let me invite on my guest, Dr. Rachel Brown. Hey Rachel, how are you?
Hi, Bella. I'm really good, thanks. How are you?
I'm great. I'm super excited about this conversation because I have never ever had a psychiatrist on my channel. So this is going to be a very special conversation. I would love to open up the conversation with the question, how did you find the carnivore diet?
Oh gosh, good question. I've had an interest in nutrition for years and years and years now. And I first probably ventured into low carb, I don't know, in about the year 2000 or thereabouts, whenever Atkins was big and came out. 5 years or so ago, I was keto, and I ended up following Vanessa Spina, or Ketogenic Girl, as other people might know her as. It wasn't those posts, though, that convinced me to consider trying carnivore. So I did a bit of research after I'd seen that, because at first I thought it was absolutely crazy. I remember saying to a couple of people at work, have you heard that some people, all they eat is meat? And I ended up going on YouTube and watching Michaela Peterson tell her story at one of the big meetings. And that was a really compelling testimonial. Yes. And then it was actually Sean Baker, a video shortly after that. It was a really nice talk just all about how the nutritional research world and paradigm, it's all broken. And it just really hit home to me. I've really admired all your work over the years, Bella. I have to say, I can't tell you enough how helpful it's been just watching your content. And something that I kind of align with is the fact that I'm quite an all or nothing person as well. So as soon as I found out about this carnivore stuff, that was it. I literally listened to a few hours of podcasts on YouTube and then thought, I need to try this. That's what I did.
Amazing. So how long have you been carnivore now?
And so I've been carnivore 3 years now.
When you did find out, this whole mind-blowing thing about nutrition, right? Carnivore diet, you initially thought it was crazy. And then after experiencing what I imagine great benefits, eating this way, did that change everything you thought about nutrition's relation to mental health?
Absolutely. So 3 years in, I'm still learning about nutrition and the different impacts of different foods, certainly of my N of 1 in my experience. So I'm a traditionally trained psychiatrist. I qualified from medicine from the University of Edinburgh in 2003, went into training psychiatry from 2004, and that's what I always really wanted to do. That's why I chose to do medicine in the first place. I was 22, I think, when I started working as a doctor. So you go to university pretty young here, 17, and then you're out 5 years later. But anyway, it was about 10 years or just under training in psychiatry, and I've been working as a consultant psychiatrist for over 10 years now. And at the moment, I'm based in Edinburgh in Scotland, and I work in a crisis team. So I see people at home who probably in years gone by would have been admitted to hospital. That tends to be a lot of people, all walks of life, all sorts of diagnoses and problems, a lot of depression, a lot of suicidal people, psychosis, schizophrenia, bipolar, all sorts of diagnoses.
What type of profound benefits did you personally feel after going carnivore?
Probably the biggest thing for me was to do with satiety and just regulation of appetite, and also food freedom. I kind of always knew that I'd had a bit of an issue with sugar, and I consider myself to be a sugar addict. I don't think I really fully appreciated all of the issues I had around food addiction until I was carnivore, and there was just complete absence of any preoccupation about food. I was able to go long periods of time and fast much more easily than I could even when I was keto. And so I remember the couple of years that I was properly keto and I was following one of Vanessa Spina's plans. I remember when she was the person who first introduced me to intermittent fasting. And I remember thinking, like, oh my goodness, I'm not going to be able to not have breakfast or, skip one meal in the day. And how do I do that? And I did it with keto, but the minute I went carnivore, it was just so much easier and just came much more naturally to me. I didn't go into carnivore thinking that I had any major medical issues, but actually I just don't get sick anymore these days. I did have some eczema, and so that's completely gone. And another thing is PMS, because I just don't ever get any PMS these days. And that's been a bit variable over the years, but it's a definite improvement on carnivore.
So since I am ex-vegan, you guys all know I've been vegan for 6 years, and I love hearing fellow ex-vegan experiences and stories. So Rachel, since you were ex-vegan, could you share how long you were vegan and what it did to your health?
So I was vegan just for about a year and a half. I got into that because we'd been on holiday. I'd been on holiday with my family, and it was in Portugal actually, and there was some really great fish restaurant, and I was eating fish, and I remember thinking, oh, this must be so healthy. And because the food was just so amazing, when I went home, I thought, oh, maybe I should be pescatarian. And then that's what started me off on going down the rabbit hole of doing all the reading about vegetarian and vegan diets, and then reading the China study book and all the other sort of propaganda that's out there. I remember distinctly at a certain point along that journey, thinking that my body composition was changing and not in a good way. So I was putting on weight. I lost muscle definition. And I remember just thinking, oh, this isn't great, what's happening? But maybe this is what's supposed to happen for the animals, and it's all about the animals. I think it's absolutely crazy now when I think about it, but that's what was in my mind at the time, and I stuck with it. My health deteriorated, so the only time in my life I've had flu, and I had it quite badly. And I don't think that's a coincidence, because I've been working throughout ever since. And as I said, I just never get sick anymore on carnivore, and improved immune health is one of the biggest benefits that I've had from going carnivore. So different to me in terms of how I felt when I was vegan. I remember somebody asking about the vegan diet at the time, and I remember saying, oh, it's great because I'm really enjoying the food. And I remember thinking, oh, I felt light after meals, but actually in retrospect, it was just that I was still hungry and I was just never satisfied. Yes. It was actually after I got flu and I lost my appetite for 2 weeks. I remember we'd gone out for a coffee one day, my husband and I, and there was a tuna sandwich in this coffee shop. And I remember just thinking, oh, I could kill to have that tuna sandwich. and I remember saying to him, I really want that. And he was like, well, just get it if you want it. And I was like, no, I can't. No. The very next day, because I just could not stop thinking about it, I went back and got it. I remember how guilty I felt. And I don't remember what else was the first thing that I ate, animal food wise afterwards, but I remember just feeling incredibly guilty and having to brace myself to take the first few bites again. But once I did that, there was just no looking back.
That stopped you from even more detrimental health issues. That's a blessing right there.
Absolutely. And that's the other thing I didn't say about carnivore, was one of the benefits for me is just crazy body recomposition. So in terms of muscle definition, I thought things were okay when I was keto, but I remember being in the toilet one day at work, seeing my abs in the mirror and thinking, oh, like I'm getting more abs, and this is only that was 2 weeks within the first 2 weeks. So I know that there have been clear body composition changes, and I've got so much more muscle now, and working out was much easier. So was able to do way more push-ups within a week of going carnivore than I'd ever been able to do in my life. And the progress has just continued. So when I compare my body now to years ago when I was vegan. It's like night and day. There's just no comparison.
How old are you, Rachel? And do you have any children?
I'm 41. Yeah, I've got one son and he's 9. He's always been a really picky eater, and I have a lot of regrets that I didn't stumble upon this sooner. I think it's really interesting because I think you can see children get addicted to sugar from a very young age, very young age. He's been a picky eater, and it's taken a while to get him more into meat, but now he's eating a lot more meat. So he loves his bacon, and he absolutely loves egg burgers. So I don't want him to be too different to his peers when he goes to other people's houses and parties and so on. So he does eat sweet, knows a lot more about nutrition than the average child, because he's probably sick of me telling him. He started reading ingredients sometimes and then pointing out, look how much sugar is in that. And yeah, we have funny conversations. I remember when he was younger, he used to get sick a fair bit, as kids do, with high temperatures and colds and so on. And since he's been eating more meat, I can't remember the last time he was actually sick either. So I think his health has been better too.
Was there like a specific turning point where you realized all this time I have been working hard studying towards health, and I did not realize that nutrition is this important? Was there a specific moment where that light bulb switched on?
The moment for me was when I came across Brett Lloyd. I still remember coming across him on Instagram, and he obviously posts quite a lot about the benefits he's had in terms of his mental health. And I asked him a question. I think it was about whether he was on any medications anymore. I was just genuinely inquisitive and wanted to know more about this person who was saying that they'd recovered from decades of serious mental illness and were no longer on any treatment, and they'd recovered just by eating meat and drinking water. And that's really what opened my eyes. And I suppose all the other people I've come into contact with in the carnivore community. 2 years ago, I did training with Georgia Eads, part of ongoing professional development. So that was her course looking at the ketogenic diet for clinicians. So it was fascinating listening to her as well in terms of the success that she's had with her private practice and the patients that she consults with. I've always been somebody who's preferred going down holistic health treatment routes as opposed to conventional Western medicine, despite the fact that I practice in allopathic Western medicine. Just seeing the number of people who really have improved their mental health through altering their diet, just it doesn't sit comfortably with me in terms of just standard psychiatric practice anymore, because we don't look at diet at all. I'm sure most of my colleagues, if they ever watch this or ever speak to me about this, will think I'm absolutely crazy. It's unfortunate in medicine because I think a lot of people want randomized controlled trials and they want published research in order to even think about offering new treatments to patients. But the reality of it is that we prescribe lots of medications off license and that don't necessarily have a clear evidence base behind them. I think people are quite often happy to just reach for a prescription pad because they're familiar with using medications. They don't necessarily think beyond that. So the Western medical model is very much see a patient, make a diagnosis, and then usually prescribe a medication or a psychological treatment or an occupational therapy intervention or some sort of social intervention. But I think we need to be paying more attention to metabolic health and diet.
Speaking of those two things, you recently came out with a new book called Metabolic Madness. So could you talk a little bit about your new book?
It's basically all the stuff I want to tell patients that I don't get much opportunity to say. Right. I wanted to write something that was short and easy to read and accessible to non-scientific people, because I know how difficult medical jargon becomes. It just becomes like a second language for some people who aren't used to thinking or speaking in medical terms. The more education that I've done for myself, so continuing professional development, and the more I've been in contact and actually seen for myself the success that people have had firsthand, and then familiarise myself with the literature in terms of case reports of people who have managed to come off long-term medication and get into symptomatic remission from a psychiatric point of view. I just felt a calling really to try and get the message out there. I wanted to cover the basic science and the reasons really why people need to pay attention to their metabolic health, and it's so interlinked with mental health.
I have linked Dr. Brown's book down below in the description box if you guys want to check it out and order it on Amazon. It's in the description box. So the next thing that I would like to talk about, you are practicing right now and you have patients that you are helping. Are you allowed to tell them you should change your diet if you want to heal?
I don't think that there's anything wrong with telling people that there are people out there who change their mental health through changing diet. So after I did Georgia Eads course, I felt a lot more comfortable in terms of understanding the basic science behind the reasons why a ketogenic diet could be really helpful, or a very low carb diet could be very helpful for improving someone's mental health. So I do talk to patients about it, but just because of where I practice at the moment in terms of the crisis team, I'm seeing people at their worst times. We see some patients who've been in hospital following possibly a brief or even a lengthy admission, and they've recovered partially, and then they come out to see us at home for a while before they're then discharged from our service. And it's not necessarily the right time for somebody to make a drastic change if they're really in an acute crisis. Right. I just have to hope that giving some information and giving some handouts and offering some hope might sow the seeds for a later time when somebody's more stable, that they might then take a look further into the information for themselves. I'm involved in a clinical trial at the moment locally that's going on, looking at ketogenic diets and bipolar disorder. And I think there's a similar arm to the trial happening at Stanford and possibly another arm in Australia. So that will be really interesting. And that's actually really exciting to be involved.
I have a lot of members in my community mostly that inspire me to ask these types of questions. So I have so many people who come to me and they say, I found carnivore diet and now I want to stop taking medications, either for my anxiety, for my depression, just mental health issues, bipolar included. I want to stop taking medication. What do you recommend somebody like this do? What should they say to their doctor?
I think just having an open and honest conversation to begin with, to say, look, this is the information I have. This is what I've been doing. This is the diet I'm following. And I'm in touch with other people who have had success on the diet, and some of whom will have managed to come off and discontinue medication entirely. Yes. I think it's always a reasonable conversation. And if you're seeing a reasonable doctor, they should always be open to the suggestion of trying to look at reducing medication. I think it's important though, there will be certain circumstances where it might not be safe or it might not be the right time. So I would just have to hope that people were being given good advice from their psychiatrist. I would say to people just probably to trust their intuition and to have a sense themselves as to how much they can trust the doctor they're working with, and if they feel they're getting good advice. I mean, if not, then it's not unreasonable to ask for another opinion elsewhere.
And I do want to emphasize, if your doctor is shaming you, gaslighting you, making you feel like you are on the verge of death, or pushing you to take medications, that's I think a good sign that you might need to find a new doctor. So I will put some good resources, links down below in the description box that you guys can explore if you are looking for a new doctor that supports the low carb carnivore diet way of eating. And of course, if you guys are looking for real people to connect with, Dr. Rachel Brown herself, she is part of my community, the Steak and Butter Gang, and she is more than happy to connect with fellow carnivores who are interested in healing their mental health issues and physical issues. Check out the link down below if you are looking for a real supportive community. Could you share what you have researched and what you know about the science behind why the ketogenic diet works?
Yeah, absolutely. I think a lot of mental health difficulties boils down to inflammation in the body. And I think actually not just mental health, most chronic health conditions come down to inflammation. Deficits in the brain's ability to use glucose efficiently tends to deteriorate in certain conditions. We know that the brain requires a lot of energy in terms of the body, so that it has a lot high energy demands on the body. And if the brain cells start to underperform in terms of being able to access glucose for energy, that's when you can end up having cognitive deficits and other symptoms that might well go with that. Probably the most researched condition is Alzheimer's disease, with researchers referring to dementia now as type 3 diabetes. But there's evidence of insulin resistance and difficulty with brain cells being able to access enough energy in order to function in other mental disorders as well. The thing about being in ketosis is that you end up changing the machinery in your mitochondria. So if people think back to biology lessons from school, they might remember that mitochondria makes up part of your cell. And that's really the energy powerhouse of the cell. And so ketones themselves are anti-inflammatory. And when you're keto adapted, your brain can end up running on ketones instead of having to rely on glucose. And that means that when your brain cells aren't able to access glucose because of the metabolic problems that your brain has, they can then access ketones and just run on ketones, which tends to be a cleaner fuel supply for the brain. We know that being in ketosis actually increases the number of mitochondria, and so it gives your body more access to energy. And then there's always the gut brain connection. So that brings me back to the functional medicine side of things. So some people refer to the gut as your second brain, and there's clear signaling that goes between the brain and the gut and vice versa. And we know that a lot of mental disorders are associated with insulin resistance. And what tends to cause insulin resistance? It's having too many carbs over too long a time and constantly your body having to constantly release insulin to try and bring your blood glucose levels down.
Why do you think we're struggling with mental health now more than ever? Even with our teenagers and our young children, we're having more issues with mental health. Why do you think that is?
Well, I think mental health disorders have been on the increase ever since there've been general shifts in the diet towards more processed food, seed oils or vegetable oils. That's a absolutely huge issue in terms of our omega-6 versus omega-3 ratios being out of balance. So having too much of the inflammatory oil and not enough of the anti-inflammatory omega-3s. And I think if you look around at the average person, most people eat just highly processed junk food, and these inflammatory seed oils are in everything. Just absolutely everything that's pre-packaged. The government dietary guidelines came in the late 70s and early 80s. Eat low fat, don't eat too much meat, focus on complex carbs, fruits and vegetables and vegetable oils. And in my opinion, just all the wrong advice.
And what about other factors? So I know that my channel here is really just carnivore diet, nutrition, food, but I love discussing other important factors, pillars of good health.
I'll probably start with sleep, because I think sleep is just absolutely fundamental to health overall. And we ask about that. And then we prescribe people medications that can help them sleep, but actually end up having detrimental effects in terms of the quality of sleep that they get. We know that alcohol affects sleep quality. I know I'm aware a lot of people report that their sleep's vastly improved when they go carnivore. I do know that. And people talking about needing a bit less sleep overall and being more energized. But yeah, sleep is fundamental, and you can see the effects. I'm sure we all know when we've had times where we've had a bad night's sleep and just how knocked off you end up being. And so disorders like depression and anxiety, people's sleep can be highly disturbed, and it's really hard to tease out, what symptoms would somebody have if their sleep was actually okay, if they could get a really good foundation for their sleep. Yeah. I suspect a fair bit would improve for them.
Yes.
But yeah, physical activity, exercise, there's clear evidence there that being physically active can certainly be effective for mild depression. GPs over here, so general practitioners, they only have 5 or 7 minutes to meet with a patient. And there's been a huge problem for years of overprescribing of antidepressants. So some people, when they're more clued up, they will focus on lifestyle interventions and prescribing somebody exercise. And there are gym schemes over here, but I think our environments are just highly toxic these days.
Yeah, highly toxic. And now with social media, kids, they need to see something in less than 8 seconds.
Oh, it's just like instant gratification.
Yes. Kind of yeah. Encourages all of that type of behavior. The focus is not there anymore. So what are your tips to really help manage stress, de-stress?
I think getting out in nature is a huge thing. Just going for walks in nature, it can be hugely therapeutic. Meditation can be really helpful for a lot of people. Not everyone can afford it, but I don't know a lot about Chinese medicine, but I've had Chinese acupuncture in the past, and swear by that. I think that's absolutely amazing if somebody can afford that. I used that myself a number of years ago for managing stress when I was going through a particularly difficult period of time with family ill health. Just exercise, I think physical activity, just moving your body.
And I would love to add to that, talk to somebody, socialize. And I know that, you know, with these past 2 years, a lot of us had to decrease our social life, but there are so many communities that are up and running, active, vibrant, that you can hop on Zoom calls with tons of carnivores who are social, who are nice, welcoming, and who want to talk to you.
Absolutely. 100% agree with you on that. I didn't really, although I worked throughout the last couple of years, and a lot of doctors ended up doing remote consultations, but because of the job that I do, we couldn't do that. And so I carried on seeing people throughout, and I can't tell you how much I appreciated just being in the office with my colleagues, being able to have a chat and a laugh about things. And I considered myself to be very fortunate in the last 2 years that we were able to carry on working in a team, and I had that direct contact. But even when things started to open up again, and you were able to see friends again and give people hugs. I mean, hugging is such a big thing, and not everyone's a hugger, but that can be hugely therapeutic, just having that social time. And I agree about community. I mean, when you're doing something like Carnivore, I started out, and I've been attending meetings at Revero for a long time. I tend to go to the mental health meeting there, although my attendance is a bit ad hoc, just depending what other things I have going on. But I felt a huge benefit when I was able to start going to meetings there, and I didn't really do that in the beginning. But yeah, I would say, I've heard you say it as well, for new carnivores, community is so essential. So I think that just applies across so many different situations.
Yes, community, and also actually physically connecting with this community. You can't just be a part of a Facebook group and then put a couple posts, read a couple comments, and you know, imagine that you can get any type of benefit out of that. In fact, a lot of these Facebook groups, they can be quite toxic because of how either dogmatic they are or how strict they are. So it's also very important that you align with the right community for you. So again, if you're looking for one, check out the links down below or go to sbgmeetup.com. So, you know, when you were talking about socializing, right, and what it does to you, it reminded me of oxytocin for some reason. And I'm so curious what carnivore diet does to your brain chemicals.
You're absolutely right about the oxytocin thing. So that's what new mothers get when they interact with their baby and breastfeeding and holding the baby and skin to skin. And I do remember reading something a long time ago about pets as well. So if you're just stroking your dog, you can get release of oxytocin then. But I mean, in terms of using different activities for relaxation and so on, there are certain chemicals like GABA is one of the main relaxation chemicals, neurotransmitters. There have been some studies published just very recently in the UK by a group of critical psychiatrists who I very much admire the work of. And they've just come out publishing an overview study, so looking at all the different studies in the past to do with serotonin and depression, and they're coming out and saying there's not really any robust evidence to prove the serotonin theory of depression. So I think there's still a lot that we don't know just in terms of the brain chemicals. So the monoamine theory of depression, which is all to do with the brain chemicals, it's still very much theoretical, although that's been the whole basis for the development of many different drugs over the years for depression, so the antidepressants.
I've experienced this myself. When I went carnivore and I exclusively eat meat, I experience better mood. I just feel happier. And I even said in the beginning of my carnivore journey, I remember sitting down, filming a video for my channel and saying, I feel like a dark cloud has lifted. That's literally how I feel every day when I wake up. How is it possible that eating meat will create this type of effect?
My theory on that is that a lot of that is to do with your gut and healing that goes on in the gut, because again, there's so much we are yet to find out about the microbiome, but it's made up of so many different types of organisms, a lot of which are bacteria, different bacterial groups, and you get shifts in the different groups of bacteria according to your diet. I know that some people criticize carnivore and would say, oh, you need to have variety in your diet. And you see so much on social media about eating the rainbow and having all this, fiber to have a good microbiome, and certain superfoods that wouldn't necessarily be carnivore. But I suspect in years to come, we're going to find out that there's going to be more studies into the gut, and the gut the bacteria in your gut, are the things that produce the neurotransmitters. So most of your neurotransmitters that we talk about are actually housed in the gut. And there are these pathways that communicate between your gut and your brain. So I think it's more about positive shifts in gut health that then have knock-on positive influences elsewhere in the body, as well as the brain. I had difficulties for probably about 5 weeks on and off, I would say, just with gut type symptoms that were on and off. And it surprised me because I'd been keto for quite a while beforehand and ate a really clean diet. Just from my own experience, I think there were quite profound shifts in terms of my microbiome on carnivore. And it's really just interesting to hear other people who speak about that. I think I remember listening to Ken Berry at one point talking about that. Yes. In terms of transition symptoms for carnivore.
And for all of my new viewers who are new to the carnivore diet, who just started, or who are just taking their time learning about this lifestyle, if you do decide to transition or jump into the carnivore lifestyle, I highly recommend that you stay prepared with some high quality electrolytes. It can be any electrolytes, but from my experience with Element, it is only high quality. The ingredients are 1000% transparent, and they have an unflavored, non-sweetened, zero stevia electrolyte flavor. If you're experiencing things like headaches, low energy, fatigue, if you're getting muscle cramps after working out, you could first try salting all of your meals heavier. And if that still doesn't do the trick, these Element electrolytes are fantastic. I have a bunch of their full-size boxes right here, and the flavor is raw unflavored. That has zero stevia, literally just the 3 electrolytes measured out for you. So you have sodium, potassium, and magnesium, and that is it, which is so rare in products these days. They always try to sneak in poisons, chemicals, additives, sugars. This one has none of that. These are what the little packets look like. You just rip one open, pour it in your beverage of choice. It could be iced water, plain water, coffee. Mix it in, drink it down, and you are set. This is what their free sample pack looks like right here. You guys can get a free sample pack with any purchase with the URL on the screen. Just go to drinklmnt.com/SBGAL. And if you want a clickable link, I have also linked it down below in the description box for you guys to click on. And also I can tell that you're healthy because for me, when I physically look at someone, I'm always looking at what is the condition of their skin? Is their hair glossy? Are they speaking with confidence? All of these things I feel like is a good translation of how healthy they are on the inside. And I can tell like your skin is so glowy, so smooth and vibrant, you know, so you can just tell just by looking at someone if they're in a good, healthy condition. I get so many DMs and just members just saying, guess what? I just came off my antidepressants, or I came off my anti-anxiety medications. And I find that, right? I just always find that so amazing. I'm so happy. It just makes my day when I see those types of victories. And I would love to ask you, do you think anybody can come off their antidepressant and anxiety medications?
I would be hopeful that a lot of people would be able to come off. There can be quite a process of fine tuning. So I have heard of people where they've been able to narrow down having panic attacks to a very specific single food source. So food intolerances can come into it as well. Absolutely, I would put hope out there that getting your diet right should offer a lot of hope to people in terms of being able to reduce medication or even eventually manage to come off them. So Brett, for example, is doing fantastic on regular beef and bacon, and he doesn't need to necessarily buy grass-fed, grass-finished beef. But then I know of others, so somebody with bipolar disorder who has a tendency to relapse unless they go for exclusively grass-fed, grass-finished beef from a very specified source. So I think it's very individual. I don't sit here and think that depression or anxiety is a deficit of a drug. So I absolutely believe in the body's innate ability to heal itself. And I just think that nutrition is fundamental. It's fundamental to get that right in order to let people heal. And obviously some people have been unwell for longer than others. So it might take longer for some people to manage to just find the right combination of diet and lifestyle for them and I would always say to try and work with their healthcare provider and not to stop medication suddenly, because that can be dangerous in certain circumstances. But to look at gradually reducing in conjunction with a health professional. I have fantasies of eventually getting into practice where that's all I do is try to get people off medications and optimize their diet. That would be my ideal in the future. So working towards that.
I always say people like you, doctors who are in the medical field, you guys are rare gems because we rarely find a doctor who is going to advocate change your nutrition rather than go with medications or go on an operating table. I recently interviewed Dr. Ovadia, and literally his book is Stay Off My Operating Table. And I think that is just so amazing that you guys are willing to work hard to spread the message and share that there is a route where you can just change what you eat and heal it all. So I think that's amazing. And I think you deserve just a huge round of applause for that. So thank you for all of your work, Dr. Brown.
Just when you were speaking there, I was thinking of anti-psychotic medications that we prescribe people. So something that really frustrates me is that there are lots of antipsychotics that in my experience have helped people when they've had acute psychosis. But a lot of the modern ones actually cause diabetes or cause insulin resistance and pre-diabetes in patients. And the Western medical response is to prescribe a diabetic medication, so metformin, or put them on some other sort of calorie restricted diet to try and lose weight. And I just think there's so much that we do not get right, and we could be doing things so much better. And I just think it's unfortunate the way Western medicine has gone in terms of developing and the influences that big pharma has had on the profession.
Yes.
So that's a particular bugbear of mine that I have.
I understand. I always get enraged when I hear from members or when I'm interviewing someone that their doctor literally told them, if you want to heal X, Y, and Z, you have to go on a 1,200 calorie diet. That has actually been brought up before. That, or you have to go on a high plant-based diet or cut out all meats. That just enrages me every time I hear anybody who tells me that. So for anybody who is watching this video and they really want to give Carnivore Diet a chance because they heard what you had to say, they are hopeful that they can get better, what are your top 3 tips to just start the Carnivore Diet?
Get a community. So I would say get a community and learn from people who've walked the walk and been through the diet before. I didn't necessarily do that in the beginning, so I kind of learned as I went along and didn't make the best choices at the start. But I think it can be really important, especially for women who maybe are restricted for a long time, just to make sure that they're actually eating enough, because your body and your brain needs energy and it needs fat for energy to run on. Yes. So community is a huge thing. I think there are so many great podcasts out there and books. I particularly like Sean Baker and everything that he's doing and the very pragmatic approach he has. And I absolutely agree with you with the difficulties with Facebook groups. I ended up joining quite a few at the start and leaving quite a number because there were just dogmatic opinions that weren't necessarily helpful and confusing advice that's out there. So absolutely, I think your community is amazing, Bella, and there's so many people joining all the time, and just being able to learn from the experience of people who've followed this lifestyle for years now, and learn from their mistakes can make it so much easier for somebody starting out new.
On top of that, Dr. Brown is going to be a September guest speaker in the Steak and Butter Gang Challenges. So I find that incredibly exciting. I'm so honored because this is our very, very first psychiatrist who is carnivore. So this is very special. If you guys want to submit your questions and learn from Dr. Brown live on Zoom, feel free to go to sbgmeetup.com or check out the link down below so that you guys can meet her. Great tips, Dr. Brown. Where can people find you? Please announce anything exciting now.
So I'm on Instagram as Carnivore Shrink. That's probably where I'm most active. I have as I say, I go to Revero meetings sometimes for the mental health drop-in group that they do. I try to come to some of the Steak and Butter Gang meetings as well. I have a website, although I have thoughts of changing that, but at the moment it's www.foodforthoughtpsychiatrist.com. I don't update that as much as I do Instagram, so I'd say Instagram is probably the best place to get in touch with me. And I try to follow as many people as possible who are following carnivore and for their mental health and getting success that way. So I'd love to be in touch with people who are doing it and getting success. And I've been particularly excited recently because there's somebody on social media whose borderline personality disorder has improved vastly on carnivore, and that's the first person I've come across with that particular condition, and that's a disorder I love actually working with day to day. So that's been incredibly exciting to watch her progress. So yeah, feel free for anyone to contact me on social media that way.
All of Rachel's social links are also in the description box, and please go order her new book, Metabolic Madness, on Amazon. Thank you, Dr. Brown, for being here.
Oh, thanks so much for having me, Bella.
Thank you all so much for watching the video. I really hope you found this discussion to be helpful and informative. Please do share this video with friends, family, coworkers, anyone who you think would benefit from this conversation. You can also help me spread the word of the carnivore lifestyle and its amazing, profound impact by sharing my channel and videos that you like on social media platforms. Please also take a minute to hit like and subscribe. And if you turn on the bell notifications down below, I think it's on this side, you will always be alerted when I post a new video. Again, Dr. Rachel Brown will be one of the guest speakers coming into the September challenge. In addition to Dr. Robert Kiltz, Dr. Elizabeth Bright, Professor Bart Kay, and Coach Cherish Thompson. To have access to all of these guest speaker Q&As, feel free to join the September challenge at sbgmeetup.com. And by the way, you are able to submit your questions ahead of time before the live Zoom begins. And once I post the playback, you can watch and learn on your own time. Thank you guys so much for watching to the very end. I hope you all have an amazing rest of your day, and I will see you in the next video. SVG out.